So I am going to welcome to the stage our panelists for our panel on moving forward with improved outcomes for Indigenous maternal health.
Good morning, everyone. Good morning. We are excited to be here today to have this conversation. I'm honored to have the opportunity to facilitate this conversation of moving forward with improved outcomes for Indigenous maternal health. And we wanted to get started as with a very conversational topic today. And we started our conversation, we've been meeting a couple of, maybe 3 or 4 times we've met to plan and do this together. And one of our first conversations was around who we are as people and who are you. And I wanted to start for me, like with the positionality and how I come to this work. And we talked about the importance of knowing. And so for me, my name is Kimberly Denise Vance Harper. I am the granddaughter of Elmo and Mary Alice Vance, and my father is Elmo and Beverly Vance. My grandmother is Ruby George and Robert George, and I am the wife to Michael Keith Harper, who is the son of Delphine Dale and Michael Harper, and I am the mother of Christina Harper and Kayla Harper. And I come to this work as a sister, a mother, and a friend, and an advocate for Black and Brown individuals giving birth in this area. And I wanted to offer this time for our guests to actually introduce themselves.
You don't want to get tangled up first thing in the morning. Jag ögonen är Amanda Singer-Lynchia. När jag ställer touch it in the go for the long he was she but the foundation touch it is Alison and I see 45 Arizona Denosha and I just introduced myself and that hope just basically saying good morning, gave you my 4 clans. All 4 of them come from 4 strong matriarchs that run in my bloodline. And right now I currently reside in Fort Defiance, Arizona, and I kind of flipped on that. I'm actually supposed to say where I'm originally from, which is Colma, New Mexico. So New Mexican blood. But I am born and raised in Arizona. My mother is Lorraine Benson. She's from Colma, New Mexico. Currently living with me also in Fort Defiance, Arizona. And then my late father is Roger Benson. He was originally from Casa Butte, Arizona, which is just south of Delta, Arizona. I'm Danae. I'm from the Navajo Nation. Fort Defiance is actually where my people were corralled up and where we were actually posted at when we were going to go on the long walk. But Fort Defiance was not the name of the actual fort. It was actually Fort Canby. And a lot of people think it was Fort Defiance, but it's Fort Canby. And that fort has completely been destroyed, or actually just, it's not there anymore. But we know where it's at. I actually live right over the hill from that. But that's who I am. I'm the executive director for the Navajo Nation Breastfeeding Coalition. We are a grassroots organization with a fiscal sponsor. Our fiscal sponsor is the Mexico Foundation. And we provide direct support services, doula support, and lactation support. I'm also a doula and also a certified lactation counselor and Indigenous breastfeeding counselor. And I guess I'll go ahead and pass it on, and I'm glad to be here.
Bonjour. Ozawana Kodok Indigo, Susan Minhan, Indigenous Cause, Jogana Shibam. Makwe Lude, Miss Gondabi was a guy gunning in Gunjabam. In Damuki, Red Lake Comprehensive Health Services, Strong Foundations, Family Spirit Supervisor. I am Endow, doula, Minowa, Indigenous breastfeeding counselor. Minowa, a community health worker, Minowa, certified nursing assistant. I'm in the process of pursuing a nursing degree and hope to be finished before I retire. just like with Amanda, I introduced myself, giving you my spirit name, Ozawana Koduk, and who my clan is, and that is Bear, and where I come from. I come from Red Lake, and my father was Peter Netto Jr. He was a 20-year U.S. Navy veteran, and my mother was Teresa Stately, and I have the honor and privilege of being a sister to 11, a mother to 3, a grandmother to 6, and an auntie to 135. So, miigwech, bizindoye, thank you for listening.
Yate bene she tilt kiani and shlan people 20 versus chin. Said this gives me that shit check if you need that nala. Agata dinan sansle ishla. She ashla shiaj ta shit naki. Good morning, everybody. It's just customary for me to introduce myself in my native language to address my relations in the room. I basically did the same thing as Amanda. I come from, 4 clans that are from just strong women in my lineage, and I have 5 kids. I have 3 boys and 2 girls. 4 of them have started school this week, so it's been kind of hectic. I was born and raised on the Navajo reservation. I went to school on the reservation. I left school about 20 odd years ago, and to pursue higher education, and have lived in Phoenix since that time. And I'm I'm a daughter, I'm an auntie, I'm a mom, I'm a granddaughter, I'm a friend, I'm a coworker, but yeah, just to touch on my background just a little bit, only because this will be relevant in when I speak later. So like I said, I left home to go to school at Arizona State University. From there, I worked, while I was an undergrad, I worked in a pharmaceutical place as a receptionist, and I moved on after I graduated and worked at Gila River Indian Community, which is just south of Phoenix, probably about 30, 40 minutes. And I was a program manager for a community health education program and a community health nutrition program. Within the community health nutrition program, we really looked at revitalizing indigenous foods, culture, and language as a way to heal. And we had a coalition, so all this work was driven by a community. We took community's ideas and put them into action. So when I stepped into this position, that's kind of what I did, and we'll get into that later, but just wanted to give you just a little bit of background of where I come from when I come into this circle. I also would like to thank the ladies and the committee for inviting me into this space.
Thank you all for introducing and sharing. We wanted, you'll see the Who Are Your People book. It's a children's book, and it actually talks about the lineage of who you are and being proud of who you are. And one of the conversations that we had was being asked that question when you're actually working. And so I am a nurse by background, and one of the stories we talked about was when I had just gotten engaged, and I was in Eastern North Carolina, and the patient that came in, their last name was Harper as well. And the question was like, "Oh, so you're a Harper? Which Harper are you?" And I was like, "Wait a minute, is this a good thing or a bad thing?" Because there's some good Harpers and there's some bad Harpers. So which one are you? I was like, "Well, I don't know. I just said yes to the man." But when we came down to it, and we're having that conversation, and what it means, it's almost being vetted, because that question happens in my culture often, like, who are your people? And so that you kind of go down, and it's a part of trust. And Amanda and I were having that conversation, a similar conversation, and you want to share your experience that you mentioned then?
Oh, you mean my last name? Yeah. The same thing. My last name is Singer, but my actual maiden name is Benton. just imagine a Navajo girl, the surprise of my white teachers in my school in elementary. Amanda Benton, I'm like, here. And they were expecting to see a white girl. I'm like, your last name is Benton? It's like, yeah, it's a long story. It's actually a given name. It's not our actual name. Um, but my married name is Amanda Singer, and I didn't mention that I've been married to my husband, David Singer, for 23 years, but we've been together for 24. I have 4 children, 3 amazing young men who are 26, 21, and 19. And then my youngest is my baby girl, my only girl, Najoni. It's actually pronounced Najona, but it's really easier for everyone to say Najoni or Joni. Um, and my last name is Singer. And whenever I say introduce myself, I get questions of 2 locations. Which singers are you from? And I have to explain to them it's not my maiden name, and it's actually my married name. And they're like, okay, which singers do they come from? I was like, Kianta, Chalchinbito, and then it's the same thing as Kimberly experienced here. Are you from the good singers or the bad singers? And I am like, I don't know, you guys can figure that out on your own. So that's one thing that had happened. But also when they find out where I'm originally from, Castle Butte, which is just south of Delcon, they think that the Singer part is my maiden name because one of my relatives there, their last name is Singer. His name, he actually passed away, Tommy Singer. I think he was a really good, well-known jewelry silversmith person. And they always ask me if I'm related to him too. I'm like, yeah, but it's not where the Singer comes from. So it's like really interesting the response that you get. And Lynn is actually from Kienta. And then when she heard my last name too, she was like looking at me like, which singers do you come from? So that's our story right there. So it's really important to really carry your last name with dignity because, and just be proud of who you come from, whether it's your maiden or your married last name.
And one of our conversations with that was related to trust. A lot of people have asked, how do you start building the relationships? And we wanted to make sure that we highlighted who your people are and how that connects to where you're going to and the work that you're getting ready to do and the community that you're in is also connected to the trust that happens. So I'm going to transition in and just share some of our data to get started. We know that the maternal mortality rates, we know that they're non-Hispanic Black women were 2.6 times more likely to experience a maternal death compared to non-Hispanic white women. But then we also have our rates when we think about there's 62.8 represents 18 deaths compared to the non-Hispanic Black ratio, and which represents 663 deaths. And then when we think about the pregnancy rate related deaths among American Indian or Alaska Native persons, the underlying causes, the top 3 are mental health conditions, hemorrhage, and amniotic fluid embolisms. And then when we think about the percent of live births in 2019 born premature, we can see that 11.8% American Indian, Alaska Native were born premature. And then when we consider the prevalence of hypertensive disorders of pregnancy among delivery hospitals by race, we can see that we also have an increase in this location as well. Then thinking about the timing of pregnancy-related deaths, about 93.3% of pregnancy-related deaths were preventable, and then a large portion of these deaths were actually occurred during the postpartum period. And when we consider our landscape and what's currently happening, and we look at where mothers were most vulnerable, you can see across the South and across areas in the actual population there. And then a large aspect that we'll talk about in one of our groups, thinking about maternity care deserts and actually access to care and risk-appropriate care and how it's changed and transitioned based upon policies and things that have impacted the outcomes that we have. We have our self-reported postpartum depression by race and ethnicity. And we can see that we also have 22% for non-Hispanic American Indian Alaskan Native. And then neonatal abstinence syndrome percentage per 1,000 birth hospitalizations. This map kind of shows you how it goes across over. I don't think I want to use diction. And then we think about access to care and coverage by state and what this actually looks like for the percentage of all births. We wanted to go through the data pretty quickly because a lot of us know those statistics. We've seen them. And I remember the first time that I was presented with data. I was in, I can't remember, it was a class in college, and it was specifically related to where I was in school. And the top data point that was there was if you were, I think it was either the mortality rate or infectious disease. And it was like, well, if you're Black and you're here, you are most likely going to have this. And like just seeing that point was, well, wow, then that just means that I'm going to die now, or I'm going to have this disease. And it took a minute for me to sit there and say, I am not that data point. There's like the data point is just one part of it. And so we know that there's these things that happen, but we want to also make sure that we are embracing the joy within those things, because there are a lot of things that happen in between the points that we aren't highlighting. And so I'm going to transition it over to Amanda to kind of talk about embracing the joy and kind of that, the joy in trauma.
Yeah, so you all know about the Navajo Long Walk, and it's very similar to the Trail of Tears. And I know you all know that there's a lot of pain and a lot of generational trauma that's attached to that. I don't know how many of you attended the talk yesterday regarding specifically that historical trauma. And although we're trying to move away from pain porn, I guess you can say, because a lot of it, we were like during the COVID-19 pandemic, when everything was shut down, a lot of attention was focused on the Navajo Nation, specifically because of the rates of COVID-19 that was on our reservation. And it's simply because of why I'm always wearing a mask, because going home, and if I catch something, it could actually light the fire. So because of how small, and then you also seen the maternity health desert. We still have families who have to travel like literally maybe 2 hours to the local hospital. Some of them live alone out in the rural area, just basically by preference. And and then I also have my first grandchild that's due in December. And I think maybe part of it is due to the trauma I've seen as a doula, like what I've seen, how COVID affects pregnant women. And I've actually have some clients who had COVID that miscarried or had stillborn. So, that's one of the reasons why I'm really adamant about wearing masks. And I don't want to take it home and expose my daughter-in-law and my little unborn Nolly baby. We call our paternal grandbabies our Nollies, and our maternal grandbabies are Tuies. So that's my little Nolly baby. Um, and then one of the things that I've had a lot of discussions with, like my colleagues who are, whether they're CNMs, LPMs, or LMs, is why we're seeing a lot of all of these maternal or pregnancy birth morbidities like hypertension, eclampsia, preeclampsia, and things like that is one of the things that it's our opinion, I guess, our theory, that it could be because of all of the trauma that we carry. And I don't know if any of you have seen it. If you have not seen this presentation, I really encourage you to look search it on YouTube. It's called Trauma Rocks, and it's presented by Tiwa Women United. And when Kathy Sanchez and her team, when they present on it, they talk a lot about how each generation passes on the weight of their grandparents, their great grandparents, all the way up to 7 generations. And then they use stones inside Ziploc bags to just kind of show you the weight that we carry if we don't break those cycles. And me and my colleagues, when we sit together and we discuss this, we're like, maybe it's because of that. Maybe we're experiencing all of this like postpartum hemorrhage, and what we're seeing during pregnancy and birth because of the trauma. They're not getting healed from the trauma. They don't know how to start that healing, but if they do, we don't have the support system set in place to guide them through it. But when you really look at the outcomes, though, the amazing thing, despite the fact that we were basically almost annihilated, because of the long walk, we're still here. We're beginning to really work on culture preservation. My group is out there trying to really reduce the maternal death rate. I myself have my own trauma stories. My two first babies, my two older boys, my labor with them and my birth almost took my life. My third one, he was nothing. My last two was unmedicated natural birth because I wasn't sure if it was a lot of the things they did to me to intervene the first two. So the second two, I really advocated for natural birth, no medication, no pain meds, And then the surprise to my family, they're like, "You're crazy." The ladies in my family, I was like, "Really, I'm not. You just need to learn how to, move with it and calm yourself down. And, I'm okay." I was okay. But also the third one, regardless of all of that, I ended up hemorrhaging with her too. And that one, she almost took my life. Not my daughter, but my pregnancy and my labor almost took my life. So, just looking at all of this, and I think, part of the joy of out of all of this trauma, out of all of the good, we have a lot of our younger generation that is beginning to really embrace their knowledge, really try to rebuild their teachings. But also one of the things that I really enjoy about my group is a lot of them are younger than me. And that's for a reason, my team, because it gives me the opportunity to start reteaching them with the cultural birth practices. We're beginning to really delve into looking at the cultural teachings again and revitalizing that within our culture. If you were to follow us on our Facebook page, Navajo Breastfeeding Coalition, you'd really realize like exactly how much we're doing. Just recently, I'm really proud to say, like within, I think 3 weeks ago, we had our very first actual real traditional birth again, where the mom actually had her baby outside. And we had everything in place for her. She requested to use I have like a little sheep hide or sheepskin, sheep wool. She asked me if she could use that to lay down on. So, and she was really happy that she was able to birth right by the cornfield. And her midwife actually is an LPN, and she's licensed to practice in New Mexico. She's a white lady, but she was like supporting her decisions all the way through. And I think she was kind of like iffy, like, I don't know, but yeah, we'll do whatever you want. And but she was really good at making sure that the local hospital, which is Northern Navajo Medical Center, was prepared, for in the event of a transfer. So we're like, okay, we'll go along. And then after, baby came and she was laying there, we made sure that baby latched on. That's when we realized that I guess she had her doubts, because she was looking at my client and she was like, wow, I got to hand it to you. You did it. You made it happen. And we just all started laughing under the stars. It was really beautiful. But yeah, there's a lot of joy that comes out of pain. And, you look at all of our, my Indigenous sisters here, we all sat, you might have heard us laugh really loud a couple of times yesterday. And that's just how we are. That's how we express ourselves. And in a way, I think we just know how to make the best out of everything. We try not to really dwell too much on our the hardships on our past, because I think if we did, we'd all be depressed. We'd probably all be suicidal and stuff. But we managed to, find each other. We find our level ground. And yeah, that's just finding the joy in all this darkness, being that light in the dark.
Thank you for sharing your story. I think one of the things that stood out when we were talking about that was related to the connections of like having the traditional, but then also having that like risk appropriate care. Like we talk about all the connections and making sure. So you had the opportunity to make sure you had access to things if you needed it, but you still kept your traditional process. And so I think that was a really good share. Thank you. And I'm gonna turn it over, all the things over to Susan.
Miigwech for sharing that, Amanda. I know when we were meeting and listening to both of Amanda and Lynn's perspective on how we were going to move forward and present our knowledge to you all, I was just so pleased to hear that, you know, we're going to focus on the positive. We're going to focus on the joy and the resilience. And that's what I'm going to talk about today is resilience. When you look at all of the literature, there are so many different definitions. And the one definition that I really have embraced is that it's our ability to be able to manage stress and function and through our challenges, adversity, and trauma. And I also like to look at it from our tribal perspective and tribal resilience, in looking at it from the place where we come from. You know, that's where we're grounded. And I was always taught that how important it is to make every effort as often as possible to get outside and put your feet on Mother Earth and feel that power. And also our culture, our American Indian cultures across North America, or our indigenous cultures across North America have so much power and knowledge for us to be able to live comfortably every day. And that goes along with ceremony. You know, and for me, what I do in smudging and giving thanks and asking for guidance and support every day is my ceremony on a constant basis. And that really does ground me, you know, in my mind, my body, and my spirit. And our language, you know, I mentioned yesterday that our language is not translatable as smooth into English. We have so many of our words you can't describe in English. And I just think that's so beautiful. But one little tidbit, when I was learning how to read and write the language, I looked at the Guinness Book of World Records, and our language is considered the most difficult language to learn because of the 4,000 verbs and the different ways that they can be conjugated. So, and our spirituality, you know, one of our teachings in our culture is that we are spiritual beings living a physical existence here on earth. And our philosophy is to live a good life. That's what we were put here for, to live a good life. And then, of course, our tribal teachings. And we rely on those teachings of the 7 grandfathers: love, respect, humility, honesty, truth, wisdom. And I think when I think about my family, I think about that strong sense of belonging. And that was one of the things that we were always taught when we were growing up in a large family. My parents both had very large families. We visited a lot, and we were told that your uncles, your aunties, they're your parents. And so we always honored that, you know, and really felt that sense of strong belonging to all of our relatives, and our identity. Knowing who you are as a human being, and all of those things wrapped up into who you are, so that you have that identity and you feel comfortable in your skin and the place where you come from. Living a good traditional spiritual way of life. Make every effort to honor your surroundings. Everything that is in your environment is living. And that having that strong belief that really promotes within yourself that ability to respect all of those things and to honor them. So when I take care of the 4 medicines, our 4 sacred medicines, they're all alive, they're living beings for me. And that really gives me a sense of, again, care and knowledge that they're going to take care of me. We're not psychologically programmed to be individuals. We are collective, and so we have that collective responsibility to contribute to our, the safety and security and the care of our family, our clan, our band, and our tribe. So we have several levels of relationships within our communities. And it's our responsibility to know and understand that and practice that. But there's always something that has had an impact on our communities historically. And that one, as I mentioned, that having that place, knowing that place, coming from that place. And when we lost our land, our resources also went with that. And then when we were confined to the reservations, a lot of people don't know the history behind that, in that it was illegal and our people were arrested and put in prison if they stepped outside the boundaries of our designated federally recognized reservations. And that was still a law in the early 1900s until they finally removed it. They weren't adhering to it at that time, but it was still a federal law. In 1890, our spiritual ceremonial practices were outlawed by the federal government. It wasn't until 1978 that we were, I'll put this in quotes, given permission to be able to practice ceremonially within our communities. A lot of the practices had went underground, and those remnants of those ceremonial practices is what we know today and what we're hoping to carry on and to revitalize within our communities. And a couple of years ago, there was a finding, and we knew this a long time before it became public, of all of the children who were taken to the boarding schools who had died and had not been reported to their families or their communities. But when our children were taken by force, my father was one of them. He was 12 years old when he went to a boarding school right within our community. It was a Catholic-sponsored boarding school. He did not know one word of English, and he was forced to go to the boarding school on the reservation. My grandparents were jailed because they refused to sign the document giving them permission to take them. And my grandmother stood her ground and refused for 6 months, and that's how long they were in jail on the reservation. And my grandmother is who I'm named after. And I always honor her by being called Susan. You know, so if you call me Sue or Susie, I will correct you. But she was a woman of really strong conviction to our language and our culture and our ceremonies, and she refused to learn how to speak English. She refused. My grandfather was the one who learned some English, enough to, you know, be able to get by. So those relationships that that our ancestors had with their children, that was severed. We were to be assimilated and acculturated into American culture. And we're fortunate in our tribal communities that some of our ancestors were able to pass down that knowledge of our language and our culture and our ceremonies and our history. And that's what we hang on to today. And one of the other things we talk about is the violence, but we don't talk about it in the terms of being massacred. They call them wars, conflicts, you know, and we know that the true history, that our elders and our children were massacred. And that's just another long lecture that I won't go into right now. But when you look at all of that, you know, all of those traumas, those experiences that we always want to think about and to practice and to teach our next 7 generations that we are a collective, we're unified, and we want to bring all of that collective unity and wisdom forward to our next generations, our next 7 generations. So any decision we make today, we want to make certain that it's going to benefit and have a good impact on those next 7 generations. You know, I talked about our philosophy, our culture, our language, our ceremony, and those values that are taught within our communities. And I remember growing up, we weren't taught direct, like, this is how you show respect. You know, we were, the practice was modeled. We were shown how to do it through our interactions with our elders. So it wasn't a direct teaching like we have to do today. Supportive relationships, you know, are our strengths. Like I said, our family, our clan, our band, our tribe. We rely and depend on those relationships to maintain them. And sure, we have conflicts and we get angry with each other, but in the end, we know that we love and we care for one another, and we make every effort to rebuild those relationships. And then the safety of everyone, not just from harm, but from ourselves, right? Because sometimes we say, we know and understand now that when we live in our minds, and our minds can be our worst enemy, that we want to make sure that our children have a good understanding of who they are so that they can keep themselves safe mentally, emotionally, and spiritually. In our tribal communities, our housing has been compromised. Historically, we never were homeless because we had our village that we occupied to be able to stay safe from harm. And food security, hunting, fishing, gathering, you know, those are our practices that have been passed down to us. You know, I was just excited to this year to see all of the berries, the blueberries, the strawberries, the raspberries, and all those other berries But I was a little leery. Where we live right next to a spring-fed freshwater lake, and we have bears as our neighbors. And I have berries in my yard that I've observed. I watch them, so I can try to get them before they do. The last 2 years I missed them. This year I'm going to miss them again because I'm going to be gone. So I know when I get home now, all my berries are going to be gone. But having that food security, so food security, someone mentioned food deserts, that's us if we did not know how to hunt, fish, gather, and share. Wild rice is one of our staples in our community. Whitefish, walleye. I don't know if you went to any of the restaurants. Walleye I think is supplied by Red Lake in the metro area. And just overall good health. I look at all of our old pictures of our leaders who are our hereditary chiefs, and their physical health is just amazing. Like they're lean, they're strong. They don't have a belly like me. But just being physically, mentally, emotionally, and spiritually healthy is part of our philosophy in living that good life. So continuing to rebuild stronger communities through our cultural teachings to make that connection to our identity is how we are moving forward. Focusing on the strengths of who we are, and especially for our mothers and our caregivers and their well-being. Because we know that those of us who are mothers and grandmothers and caregivers, if we're not well, it's hard for us to model and pass that down to the next 7 generations. Having the respect and acknowledgement of our tribal sovereignty and our inalienable right to choose our own healing paths. I'm so thankful when people ask me to sit at the table and make decisions about the next steps and how to heal our community. It's just honoring, and I'm very humbled about that. And how we can bring in our own medicines, our ceremony, our plant life, and those other resources that are really necessary to develop and to help us establish a culturally specific way that will continue to keep our communities healthy from cradle to grave. And that's really what we look at. Rebuild those supports in the community. I mentioned our housing, housing that's affordable, accessible transportation. A lot of people talk about the limited transportation in rural areas. It even becomes more compromised in a isolated community. Traditional food security, we're working on that. We have so many programs in our community that are helping to really reestablish our traditional food security through our wild rice gathering, our hunting, our fishing, gardening, and just having nurturing childcare. As a former educator and public school educator and a administrator, having a school system that honors our language, our culture, our history. That was one of the initiatives that I had in our community, was to promote that and to implement it and to teach our children. And I'm pleased to say that the district actually embraced it after I left. And so I was like, yeah, and that's what you want. If you're going to start something, you want it to continue without you being there. And just the reconnection to the culture, the land, the language, and ceremony, economic development. You know, that's been one of the things on our agenda for many, many years, and it's just now taking root. And hopefully, before I retire or go to the spirit world, that our economic development will be better established. Miigwech Bizindoyeg. And I'm going to leave you with one question, and that question is, how can we connect our Indigenous families to high quality, culturally responsive healthcare? Miigwech.
Thank you, Susan. And now we'll have Lynn share her story from her perspective.
Alrighty. My name is Lynn Lane. I work at the Arizona Department of Health Services. I am the Tribal Maternal Health Innovation Program Manager. Our state was a recipient of the HRSA Maternal Health Innovation Grant, and that's how I come into this, space as a program manager. My responsibilities are, to engage tribal communities in Arizona, to work with them to improve their maternal health outcomes. Arizona is home to 22 federally recognized states, and we have a very large urban population as well, living in Tucson, Phoenix, Flagstaff, and Yuma. When we have these conversations about improving maternal health care, it's not just to the people, residing on tribal lands, but it's also, making sure we're including our urban population as well. These two ladies set this up very nicely because, historically with state agencies, federal agencies, there's not a lot of trust there. That partnership can be very hard to, have. Before they got this grant, the agency actively took the initiative to get feedback from the tribes. So they asked them, we'd like to go after this grant. We want to write the tribes into this grant. How can we do that? If we do this, what can we do? Two of the biggest asks they asked was they wanted their own tribal maternal health task force. They wanted space where they can discuss their challenges, amongst themselves. The other thing was, without breaking any laws or anything like that, they wanted a program manager that looked like them, somebody who was going to understand, what those challenges were and are, and how do we work through that, that's how I came into this space is, my background in working in tribal communities and having this, trying to push forward this Indigenous perspective as a way to heal is how I guess I came forward in this position. I was very new, didn't know a lot about maternal health, aside from being a mom. But yeah, so that's how I came into this space. And prior to that, just as I had alluded earlier, I worked with Gila River Indian community. Under that, while I worked there, I worked also with Intertribal Council of Arizona. Intertribal Council of Arizona was a grantee of a Good Health and Wellness, an Indian country grant from the CDC. So with that work, they presented us a framework, an Indigenous framework. And there were 4 things that they really wanted to ensure that they were brought to the table when they talked to tribes. One was accountability, being respectful, prioritizing relationships, and responsibility to community. So when I stepped into these shoes, that was where it was for me, was like, I need to take these, this framework and utilize that when I start talking to, community members, providers, in clinics and hospitals, So when we talk about accountability, it's, upholding sovereignty, data sovereignty, ensuring that we're respecting cultural integrity of each community. You know, our relationships, our conversations are respectful. That we also understand that not one tribe is the same. They're all different, you know, and having, I guess, respecting the cultural background in which they do. So there are certain seasons we don't talk about things. There are certain seasons we only do things. So ensuring that, you know, we understand, like, okay, we don't talk about those things during this time, you know, so we leave it alone, you know. Prioritizing relationships. You know, each tribe is a sovereign nation. They have their own government. They have their own timelines, you know. So it's, you know, me being patient with the tribes, but continuing conversations with them, keeping them in the loop, you know. One example is, you know, we got this grant in September 2019. I came on March of 2020, and we were, you know, because of COVID, like we weren't able to get contracts in place with our tribes, right? But we wanted to make sure that we were still engaging in that conversation. Like, we're gonna move forward this after we get through whatever this is, you know, we don't know what this looks like. But one example I'll use is, like, I have two contracts, one with Intertribal Council of Arizona, who is working with 21 of the 22 tribes in Arizona. And then the other one was supposed to be with the Navajo Nation Department of Health Services. Because of the pandemic, they had said they did not have the infrastructure or the capacity to take on this grant, you know. So they asked us to work with Diné College. So that's who we worked with, you know. So they also asked us, you know, in 1 year, we'd like to revisit this conversation to see if we can take this grant on. So we kind of went on a year-to-year contract with Diné College, you know. And each year when we went back, they just said no. This past year, they finally said, we can't do it, move forward with the contract with Diné College. So I'm happy to state, like, probably like 6 weeks ago, we have a contract in place with Diné College, you know. But the thing about it is, like, you know, although Diné College kept, our Navajo Nation Department of Health Services was saying we can't do this, we were saying we have this money bookmarked for you. How do we keep this money here? We don't want these funds going anywhere else. How do we do that? So they identified us working with Diné College. So, you know, again, prioritizing those relationships. Also, responsibility to community. You know, we make sure that this work is collaborative. You know, one of the very unique things with both Diné College and ITCA is that they have steering committees. You know, they have their own people come to into these circles to talk about, you know, some of the challenges, some of the activities, some of the initiatives that they want to see in their community, right? And all of this is community led, you know, and ADHS isn't trying to push our agenda, you know. I understand as a community member that I really truly believe that the answer lies in the community, you know. So, you know, we sit back, you know, and let them come up with their own initiatives, come up with, you know, priority areas that they want to go through, strategies. So, you know, we're really trying to have this, like, what do you call it? Harmonious relationship, you know, that's rooted in balance, you know. But we try to bounce ideas off one another. You know, if there are challenges, you know, we try to, you know, think about it together and come up with solutions. But yeah, like, you know, the two, there are, you know, I invited my contracts from Diné College and ITCA here. I don't know if you guys want to stand up. Like, I am so grateful to be working with these individuals, you know. And, you know, like, it's just, you know, and they're all, you know, they come from Native backgrounds as well. One of the other elements that we also wanted to be respectful of is evaluation, data collection. So those are conversations we're currently having. We are, with our tribal work, we're going through tribal evaluation, and we're working with the Northern Arizona University as well. And I believe Dr. Hunter is here as well, and she's over here. So these are ladies and programs that have strong relationships with tribes, and are willing to uphold and have those respectful relationships as well. Like it's the, like these, us going into contract with this work is intentional. It's like, we're really trying to improve. We're not trying to take. We're not trying to say, this is ours. This is what we're gonna do with it. It's it's for the tribes. It's for them. So with that, one of the things that like I'm pretty sure a lot of us here understand that there is we can see the difference between, like, let's say a public health paradigm versus like tribal communities, how they work, So sometimes, there are conflicts about, like, let's say like evidence-informed, evidence-based, like we know that those things are not evidence for us. Those, those are not, that would not be successful in our communities. Our ceremonies, our culture, our language, that's our evidence, and I don't know how you get that evidence-based. But yeah, so like when we went through this framework, there were things that we talked about, questions we asked ourselves. It was like, what does health look like, or what does being healthy mean to us? When we asked these questions to community, they were saying, stuff like not having illness, not having disease in our community. And we asked them, where do you hear this stuff about health? Who tells you this stuff? They're like doctors, the school nurse, experts, scientists, literature, kind of a thing. So we also asked them, like, how is health defined from a cultural perspective? And responses we got were ceremony, language, culture, like we have birthing ceremonies, we have naming ceremonies, first laugh ceremonies, just in the Navajo culture. And we asked them, well, where do you get that information from? How do you know about that? Our elders, our medicine people, our traditional practitioners, our indigenous knowledge holders. So it was like, how do we use our culture to heal is really how I looked at this work, is like, how do we find this balance? We know that we have to coexist in two worlds, in this Western world, and also, go home, I was really proud yesterday to see, my sisters in here, like showing up in their attire, like that made me proud, like we're holding on to these things, these dresses that you see, like these are, our ancestors, they saved seeds in this when we were being, when we were being taken on long walks, through these historical trauma. Like they knew these things were going to be very important to us, and they did these things, to ensure that we had them. So for us sitting up here, like this is our way of life. This is what we're supposed to be doing. This is to ensure 7 generations from now, we're still here. Our culture, our language, are still here and being practiced. But yeah, so like that's really just kind of like where I come into this space, working with tribes and working in an agency that, doesn't really quite understand, like the work I'm trying to do from this perspective. But I also have a lot of allies. I have a lot of people in here in this room who support me, who are my teachers, and I thank them every day, I know with time, it'll catch on, and, people, will be asking like, wow, that's really successful. How do we implement that into our program? But yeah, I don't. Did I answer all the questions?
You did. You answered all the questions. You did all the things. Thank you. Awesome. I wanted to keep going. Okay. Awesome. Thank you for sharing all the stories and just being here and adding on. I wanted to first, I think we had a question, like you mentioned, Susan, about what does it look like to have the quality prenatal care. Do you want to share? I know we talked about this some. Do you want to share some of what that might look like?
So as I mentioned, to ask those questions, what do you prefer? What is your practice? I know when I had my children, I had 2 miscarriages prior to having our son. And so when I was pregnant with him, we were very cautious and we really relied on the medical practitioners, but we also relied on the knowledge of our midwives in our community. And I knew that I was going to have to birth our son in a birthing center, not at home. And so just sharing that knowledge of our midwives and with our medical providers, that these are the things that are going to help me to feel comfortable, confident, and safe in delivering my baby in a birthing center instead of at home with a midwife. But just making sure that our medicines are honored, that our ceremony is, I'll use the word tolerated. I don't know if that's really a good word for it. But when our children are born, the first thing that they experience once they're out is the earth. So we brought moss to the birthing center. Our son was placed on the moss, and then after his father said words to him of welcoming him and thanking him for coming to us, he then was put on me, skin to skin for the latch, and unfortunately, I had some trauma during his birth, and so I ended up having to have a surgical procedure. And so he was still with me when they were doing that. I had to be stitched up. His doctor told me that my son's head was the largest head that he ever delivered in the history of delivering his babies. And so in the labor, he would come down and then he'd go back. He'd come down and he'd go back. And that went on for 4 hours. And this was all natural birth. And so it was traumatizing. And I'm thankful that I didn't try to deliver him at home. But yeah, just making sure that all of those practices that are understood by the birthing moms and fathers, and that they're honored in that space wherever they're at, whether it's at home or in a birthing center or in a medical facility.
Thank you. And then Amanda, I know one of the questions we talked about was actually community engagement. I think we talked about one of what it looks like to how do you engage with community if you're coming in and you're not a part of the tribe, and how do you make sure that you're integrated in communities?
Okay, well, um, that's a question that we get a lot. It's like, I'm obviously Native, Indigenous, and when people find out the work that I'm involved in, one of the things that I'm asked is basically how we're having a hard time. This is like the comment I'll get, like, we're having a hard time approaching our Indigenous community. Do you have any advice for us? And one thing is that you got to be genuine. I mean, we have really strong intuition, especially the matriarchs in our tribes. It doesn't matter which tribe you come from. All tribes, all of our matriarchs have that intuition, and they have that gut feeling. Like if you're there for not a good purpose, they'll call you out for it. And so, one of the things that I see in my community, is like with our tribal hospitals, we have a lot of non-native providers there, and a lot of them they congregate in their hospital housing. So it's like a little suburbia behind our hospital there, and we rarely ever see them out in the community mingling, being a part of the community. Granted, they may be a little bit intimidated because maybe some of the off remarks they might get out there, but what I have seen is that um, one of the CNMs that was a part of our community, well, she's Italian, so basically she's white, and she was a part of our community for a long time. She made her career in Fort Defiance, and some of you might know her. Her name is Rosemary Bolza, and she was there for a long time, and she retired there. And because she was there and her kids went to school with us, she just became a part of our community. And she was like probably one of the most trusted providers in our community. I mean, she even lived in our community. She didn't even live in the hospital housing for the duration of her career. She found somebody to rent from, and she literally lived on the res with us, on the reservation, until towards the end of her career. That's when she had to move out of that house and then find a home on within the hospital housing area. And then we also have another nurse. I remember him. His name is TJ. I don't remember his last name, but we called him TJ. And he was like from Alabama. And he was a really cool pediatric nurse. And one thing that he did was he started helping like with the local youth sports clubs. And people got so used to his face being in the community. He was like a young guy. He was like a new graduate, and he was out there. And he was so welcomed by the community that even though he was not Navajo, but he came into that exam room, people felt safe with him. And he was white. And that's one thing that I really appreciated about what I was seeing with the ones who just stepped out of their comfort levels and actually approached their community. And one thing that I really seen with them was that they saw us as human beings. Native Americans, for some reason, we are not seen as human beings by a lot of people, but we are human beings. Just our skin color is a little different. Our culture is a little different. The way we think is a little different. Even our feminism is different. It's a lot different because one of the things that we do is that we value our men. And there was a point where we were in our culture, within our ancestors, our males in our tribes never looked down on us. That was something that was brought across with the settlers and colonizers. We were included in like the war planning. We were included in the decision making. We were included in all of that. But that's where the treaties, everybody's like, yay, yo, there was treaties. But for me, I'm like, yeah, but we were forced to sign the treaties to the point to where it was because we were starved. Our ancestors were starved. They were sick. They missed home. And I'm pretty sure that somewhere along the way, it was not really brought, truthfully told to them, like in English, in Navajo or in Indigenous language, what it really was. And one of them was to remove the woman from positions of leadership. And that's a part of the treaties that a lot of people don't talk about. So, yeah, so a lot of it's just, just integrating with the tribes and then get yourself known. Be prepared to be uncomfortable sometimes. And, but once you get used to it and they see that you're genuine and that they know that you see them as human beings, you'll start to slowly gain their trust.
Awesome. Thank you so much. Thank you all for being here and for sharing today. And I think our time is up, but I did want to give you guys a small token of the medicines. And we wanted to thank you. And then I also included some earrings because, you got to be cute. Thank you.